Right. Thank you, listeners and followers. Dr. Shawn here again. My previous video, I did the unboxing of the type 1, they call it the T1DRA study, type 1 diabetic risk in adults study from Bristol University and I think a few other partners. So I'm just sort of like doing it this way. My video setup is not the best, so just bear with me. So let's just have a look at what we have. I mean, I'm going to quickly try and do, I'm not moving my camera, so this will be the view you see. So essentially, what I need to do, and I will pause the video at certain points for those that are squeamish with blood, because I know not everybody is quite comfortable seeing blood. Anyway, this is just the procedure, the process we're following. This is the wipe, and they say you should use either your middle finger or your ring finger and the sides of the finger, not the tip or not the rest point of it. So you take the swab and you kind of just clean. I'm using my ring finger and I'll just clean, get all microbes off my finger, dirt. And they say you should be hydrated when you do the test, so don't be dehydrated when you do the test. Let that dry, and then once it's dried, you take one of the lancets, got one, and then you twist the end, take that off, and the needle is basically in there. And then rest your finger firmly on the surface. Take the lancet to the side, right, side of the finger that you cleaned, and you're going to feel a sharp scratch when you do it. Oh, and there we go. To that one side, and then you'll see blood coming out. All right. And what you should do is you should wipe that first bit of blood. Take the collection tube. Take the lid off. And now we are trying to let gravity do its work. And we are just warming the finger and pressing down, pressing down, pressing down to get the blood out. All right. And we don't want the blood to clot. And what they say is, there we go. You see, I'm sorry for those that are a bit squeamish of blood. And then all you do is you kind of drop it into the, and keep your finger in a downward position and just keep on pressing all the way down the finger, all the way down until you see enough blood collecting. They want us to collect about 200, up until the 200 mark. Oops. Up until the 200 mark on there where the line is. We'll see how far we can get. They need enough sample to be able to do a couple of tests. So let's try and more. I would need a lot more blood, don't I? That's not enough. Okay. There we go. Press a bit more. Okay, just warm the finger, and just press a bit more. That's, and then just, we need enough sample for them to be able to do their work. in the labs. There we go. See, that's dropped down. Now I'm going to just put my hand beside my side of my body, so I'm just literally doing it on the side, so you can't see my finger, or you can actually see my hand. So I'm just trying to do a bit more. Just warm it and keep it warm, and push from the end of my finger all the way down to where the lancet pierced my skin. My blood isn't clotting yet because I'm keeping it warm and keeping the movement. And so just doing a bit more and just pushing the blood down. Gee whiz, they need a lot of blood. Now they say if they don't have enough blood, they will email you and let you know the sample wasn't sufficient. But they do say give as much as you can. And some people will bleed more than others. So obviously, when you think about when people cut themselves and what your body actually does internally in the vessels is blood clotting and platelet aggregation to stop you from bleeding out. So that's called wound healing. And coagulation factors get involved to stop, all this blood from just going on and on and on and on. So the body will naturally try and clot, and obviously we need a bit more blood. And there are people who will bleed more than others, and people who will bleed less easily than others. And that is just based on genetics. All right, and also whether you are hydrated enough. And if you have like a blood disorder, and if you are on some sort of a blood clotting or platelet aggregation medication, or even if you're on the blood thinning medication, I think for this study, they needed to know if you were diabetic or pre-diabetic. They needed, well, not pre-diabetic, sorry. Needed to know if you were diabetic, but they also needed to know whether you are taking any blood thinning medication and anything like that, because obviously they don't want you to prick yourself and then bleed and then you can't stop the bleeding. So I don't know. We're not there yet, are we? We're not there. We're not there yet. Not at the 200 mark. Okay, so I don't know how much more I can do on my finger, but this is an experiment and I'm the guinea pig, so I will go as much as I can. It's possible that I wasn't fully hydrated because I drank water, but they say you got to be hydrated for a couple of hours before you attempt the test. So let me just use gravity and push further down. Okay, that is a good wallop. Shake it down. Where are we at? Probably at about 100. I don't think my finger and my blood capillary vessels are actually liking this. What we do for science. What we do for science. The main reason for doing this, I just want to spread education. I want just normal people to take a proactive view on their health and their health management, to ask questions, keep healthcare professionals accountable. I mean, essentially, it's our health. We've got to take a positive step in our own health and use the facilities and the people that are appointed there to help us. So I just try and, through my YouTube channel, I do research on peer-review published papers on certain topics, then I review them. So like I just do a summary on them on my channel. I did my blood results in September because I had a bit of an issue, and if you follow my channel, you'll know I'm pre-diabetic. So I'm actually working on reversing that. I'll do another video when I update on the next round of blood tests I'm going to do for my pre-diabetes. But education is important, and understanding things, and this is where I am really passionate about making sure that I help anyone who needs help about understanding the blood results, or understanding concepts, how to speak to healthcare professionals, speak to your doctor, your GP, your specialist. It's literally just demystifying healthcare, and this is what I do, and I'm quite passionate about it. So follow my YouTube channel, follow me on Instagram, and do all sorts of stuff. Okay, so I don't think I'm going to get to the 200 because the blood is not really coming out, and my poor finger, I think my blood is starting to clot, and my poor finger is and how long has this video been running? 17 minutes. Yeah, this is way too long. I think this is the last I'll do, and hopefully my finger will recover, because I've really rubbed almost my skin off it. It's getting a bit uncomfortable, and I think I will end there. There's still blood that needs to drop down. I will close the lid, replace the lid onto the top of the tube. Tap the base of the tube against the hard surface to encourage the blood to move to the bottom. I think that's going to take a while. I'm just going to do the tapping a bit. So you can see there's still sample up there, and I need to get to the bottom. Let's get gravity to do its work. How much do I have? I hope this is enough. Okay, I'm going to use the rest of that alcohol wipe. Swipe my finger. I don't know. Can you see? And I don't know. I think it's going to take a little while to get better. It's not really painful, but yeah, it's not bleeding either. So I don't even think I need the plaster, but my finger is a little bit uncomfortable. Oh, the blood is gone. It's gone further down. It's going to get there. Anyway, it's almost 20 minutes of doing this. What I need to do now is place the blood collection tube inside the specimen transfer bag and seal it. Date and time the sample collection on this. Pop the sample in there and seal it. Put it back in the box, on this box, and then put it in the self-addressed envelope. And that's going to be essentially it. So I'm not going to bore you with the details of that. That is my contribution to the T1DRA study. They said 6 to 8 weeks before I hear back. Let's just, fingers crossed, let's just hope that this sample is enough, and they don't tell me that there wasn't enough sample and they ask me to redo it, or they tell me to just forget it. I really want to get this done. So I will upload this, and I'll include the video links to the T1DRA study, where they show you how to do the samples at home, how to package it, and all the other links as well. So we'll have 2 videos, the unboxing video and the blood sample collection video. All right. Thank you for tuning in. I'll be in touch soon. Bye.